Hello, Professor and classmates. My name is Idalia Alaves Pinto, and this is my presentation for substance abuse, fentanyl, Harrison University, NU 673, Professor Keith Jenkins. Introduction to substance abuse. In the 1960s, fentanyl was first introduced as an intravenous anesthetic after being developed in 1959. In comparison to morphine, fentanyl is a potent synthetic opiate that is 50 to 100 times more potent. It is a drug that is frequently used to treat patients with extreme pain, especially following a surgery. History of abuse. Between 2011 and 2018, law enforcement interactions as well as fatal overdoses were linked to the abuse of illegally produced fentanyl, and fentanyl analogs increased significantly. According to the CDC, in 2011 and 2012, approximately 2,600 drug overdose deaths per year involve fentanyl analogs. However, from 2012 through 2018, the number of drug overdose deaths involving fentanyl and other synthetic opioids increased dramatically each year. Some of the street names that are used for fentanyl are Apache, China Grove, Chinatown, Dance Fever, Brand, Goodfellas, Great Bear, Hitman, Jackpot, King Ivory, Murder 8, Tango, and Cash. Prevalence and epidemiology in the U.S. According to the National Institute on Drug Abuse, more than 106,000 drug overdoses deaths were reported in 2021, up from more than 106,000 in 2019. Deaths from synthetic opioids other than methadone, primarily fentanyl, also increased with 70,601 overdose deaths reported in 2021. Nearly 75% of overdose deaths in 2021 involved heroin, also involved synthetic opioids other than methadone, primarily fentanyl. According to Alta Cruz and colleagues, some of the risk factors are being white, being male, if you're in ages between 20 and 59, you're at risk if you have never been married, if you are not in a labor force, and have a high school and a GED educational. There are many other risk factors, including in this that I haven't mentioned. But if you are primarily in this category, there is a high risk that the patient will be more at risk. I also read about people who usually have chronic pain and they go to the doctors and they get prescribed opioids, and they are also at risk. Substance signs of symptoms of potential for overdose or use as suicide weapon of choice. There's according to the National Institute on Drug Abuse, fentanyl has a potential for overdose or use it to commit suicide, because a person can overdose on fentanyl. When people overdose on fentanyl, their breathing can slow down or stop, which can decrease the amount of oxygen that can get to the brain. This condition is known as hypoxia, and it can cause a coma, permanent brain damage, and even death. The care plan of a patient will consist of pharmacological treatment, non-pharmacological treatment, patient education, referral, and follow-ups. For the pharmacological treatment, when someone is overdosing, it will be when it will be Naxalon, which needs to be administered immediately after the patient is noted to be having an overdose of a drug. This drug quickly binds to opioid receptors and blocks the effects of opioid drugs, which can treat fentanyl overdose. However, because fentanyl is more potent opioid than other opioid drugs like morphine, it may be necessary to administer multiple doses of Naxalon. After that episode of overdosing is completed and the patient is saved, the pharmacological treatment will be using 3 other drugs that can help the patient stay sober and not relapse, and using any type of opioids, which is gonna lead to not have a functional life. The first drug will be methadone, an opioid receptor full agonist that attaches to and activates opioid receptors to ease withdrawal symptoms and craving. The other drug is buprenorphine, which is an opioid receptor partial agonist, which attaches to and partially activates opioid receptors to ease withdrawal symptoms and craving. The third one will be naxotrone, an opioid receptor antagonist, prevents fentanyl from attaching to opioid receptors, thus blocking its effects. For non-pharmacological treatment, according to the National Institute on Drug Abuse, counseling is a key point to be off drugs. Behavioral therapies for opioid addiction, such as fentanyl addiction, can help people change their attitudes and drug-related behaviors, develop healthy life skills, and mainly adherence to medication. Some of the examples of therapy modalities will be CBT, individual therapy, motivational therapy, and it can also include family therapy, which is very important for the patient to have some support and people who understand what he is going through, or at least have the family understand what he could be going through. For patient education, the National Institute on Drug Abuse states that some of the effects of fentanyl, as mentioned before, is extreme happiness, nausea, problems breathing, constipation, sedation, which is very important for the patient to know. It's also important for the patient to know the fentanyl symptoms of withdrawal, which can include muscle and bone pain, diarrhea, nausea, vomiting, goosebumps, cold sweats, and severe leg movements. It's also very important to educate the patient on the importance of taking the medications as prescribed. It's also important to know that they have to be consistent and with counseling and treatment and medications, things as mentioned before. Counseling forms a major key point to help the patient stay adherent with the medications. And it's also important to educate the patients, maybe not so much the patients who are already having substance abuse problems, but general population, to let them know that there are other type of pain medication management other than opioids, which is going to reduce the risk of becoming addicts and tolerate opioids more and more, and get to a point where they can no longer function. Some of the referrals that I am thinking about, it would be mostly for a MAD or SAP program in the local areas. Lake County in Illinois has a MAD program and SAP program. which states that although methadone is highly effective in treating opioid addiction, it presents some barriers to many people's substance because it requires daily attendance at the clinic for a while. With the advent of new medications to treat opioid addiction and insurance companies now covering these medications, the health department has been able to expand its medication assisted treatment program. And another referral that is very important is for the CBT therapy or any type of therapy that could be beneficial for that specific patient. And like as I mentioned before, family therapy, if possible, will be making a major change for these patients to know that they have support, that there's support within their family system, and that they are trying to help them and understand what's happening. The follow-ups that this patient needs is follow up with the psychiatrist or the psychiatrist, nurse practitioner in about 4 weeks. Go to therapy, counseling once a week or at least once a month, and also go to see the PCP in 2 to 3 weeks just to have checked any other physical health conditions that may have developed after getting addicted to fentanyl, or if they have any malnutrition, low BMI. And for the conclusion, according to the CDC, fentanyl abuse has increased in the last decade and more deaths have been linked to overdose of this opioid. The population needs to be aware of the fentanyl results of the population is to be aware of the fatal results of fentanyl if consumed in large amounts. Fentanyl is sold alone or in combination with heroin and other substances. It has also been identified in counterfeit pills mimicking oxycodone. Expand distribution and use of Naloxone and overdose prevention education for the general population. It's important as well. These are my references, but this will be all for my presentation. Again, my name is Idalia. Thank you very much for listening.